Welcome, family, staff, and members of the Graduate and Professional Student Association. It is my pleasure to share and present this poster presentation with you all. First and foremost, I would like to introduce myself. My name is Josie Chevalier. I have been with the University of Nevada, Las Vegas since 2012. I originally graduated in the School of Community Health Sciences as an undergraduate before it transitioned into the official School of Public Health. In the School of Public Health, I have also completed my master's with a concentration in healthcare administration and policy. And now I'm currently finishing up my doctoral studies concentrating in social and behavioral health. As a graduate assistant under Dr. Shanice Mooney in the Department of Epidemiology and Biostatistics, we formed a research team with faculty members who share the same research interests in reducing health disparities and chronic diseases in pediatric populations. Which brings us here today, where I will share our IRB-approved study titled The Impact of COVID-19 on Pediatric Obesity. So let us begin. In March of 2020, schools in Nevada were issued a lockdown mandate due to the COVID-19 pandemic. During the same year, Nevada was ranked 21st nationally for childhood obesity. A study was then conducted by the Nevada Institute for Children's Research and Policy that addressed data from the 2019 Nevada Kindergarten Health Survey. It revealed that 16% of children ages 10 to 17 years old were documented as obese in Nevada. More so, higher percentages of obese children were seen in rural counties compared to Clark County. Further, 30% of African American and 29.9% of Hispanic students had higher rates of being obese compared to Caucasians. Previous published studies have indicated increases in weight gain resulting from the pandemic potentially due to 1. School closures and lockdowns, 2. Food insecurity, 3. Increased overall food intake and unhealthy food intake, 4. Reduced activity, and 5. Increased screen time. No study to our knowledge has been performed in Nevada to understand the impact of the current pandemic on pediatric weight changes among youth. Therefore, the purpose of this study is to evaluate the short-term impact of the pandemic on weight change among a clinical subset of pediatric patients residing in Southern Nevada. Change in BMI was compared prior to and during the pandemic among children and adolescents who received pediatric care. Further, this study was used to determine and highlight the need for interventions among this subgroup. This was a longitudinal study of pediatric patients who were identified from a range of pediatric medicine clinics in Southern Nevada between January 1st of 2019 and June 30th of 2021. The data were assessed for significant changes in 3 different categories. 1. BMI weight changes overall, 2. Race ethnicity, and 3. By insurance type. The McNamara-Bowker test was utilized to examine categorical BMI changes from pre to during pandemic timeframe and cross-tabulated with the appropriate comparative variables. Finally, a 2-sample test for differences in proportions was used to compare insurance coverage groups. To note, the study was approved by the Institutional Review Board of the University of Nevada, Las Vegas. In the beginning of our data analysis, there were a total of 4,033 unique pediatric patients who were abstracted from the EMR database. There were 3,019 patients with visits in the pre-pandemic period and 2,850 patients with visits in the during pandemic period. However, only 1,895 patients were eligible based on having measurements available during both time points for comparison. After we removed the outliers, there were a final count of 1,884 patients who were included for our study. To describe, there were slightly more patients, 51.9% were male, 31.6% were white, and predominantly with some form of Medicaid coverage of 71.1%. To further discuss the results, we are going to look at Table 1, where it describes the BMI change among the study population in Nevada. So overall, 26.2% of the pediatric patients actually increased their BMI category, whereas 3.6% decreased their BMI category between the two time points. The remaining 70.3% were able to remain stable between the two time points. So what does that mean specifically? So 654 subjects that were of normal weight during the pre-pandemic period, 26% became overweight and 1.8% became obese during the pandemic period. Subjects who were overweight during the pre-pandemic time period, which totaled in 258, 55% of the pediatric patients remained overweight and 37% became obese. Then finally, of the 152 patients who were obese during the pre-pandemic time period, 116 patients, 76%, remained obese and 3% became moderately obese. To continue further, for the McNamara-Bowker statistics, everything was significant for each comparison. Examination of race indicated that 25.4% of whites, 25.6% of blacks, and 29.2% of other race, and 24.3% of unknown race increased their BMI categories. However, these differences were not statistically significant. Further examination by insurance coverage indicated that 22.2% with commercial insurance and 28.0% with Medicaid coverage increase their BMI category. This study has allowed us to understand the short-term impact of the pandemic on pediatric obesity changes among a subset of patients across multiple clinics in Southern Nevada. BMI was clinically assessed and not self-reported, yielding a more accurate measurement. The sample size was substantial, allowing for comparisons. The analysis from this study revealed further disparities by race, ethnicity, and insurance type, indicating those of non-white race and Medicaid coverage yielded worse outcomes. Future studies are recommended among a larger sample size incorporating a larger geographical region. Further, the significant findings from this study align with existing results from the literature that investigated weight change in the COVID-19 era in other states and globally. Again, this analysis revealed that 26.2% of pediatric patients seen in select Southern Nevada clinics increased their BMI category. This finding supports other published studies that revealed weight increases resulting from the same period. And although the true cause of pediatric BMI increase followed by the lockdown cannot be determined currently in this study, More studies and interventions are needed to determine the factors associated with pediatric weight change and improve resources and services targeted towards our Nevada pediatric population. In conclusion, we saw a significant BMI increase, which was observed between the pre and during pandemic period among the pediatric group in Southern Nevada. This study adds to the literature highlighting the impact of the pandemic upon the risk of childhood obesity in the United States. This study also provides such an important understanding of the magnitude of weight change among youth residing in Nevada and the need for effective interventions among this population. And finally, further research is needed to monitor the ongoing pandemic, including the impact of school reopenings and long-term adverse health outcomes. Thank you everyone for joining me for this poster presentation titled The Impact of COVID-19 on Pediatric Obesity, specifically in Southern Nevada. On behalf of myself and the faculty members who contributed and worked so hard on this study, Dr. Mooney, Dr. Scher, and Dr. Cross, we want to acknowledge the University of Nevada, Las Vegas, School of Public Health, and the School of Medicine. We also want to give all our gratitude to the Graduate and Professional Student Association and everyone here who attended. Thank you and have a great day.